Hi there, you're welcome to Demi RX Care channel today. Thank you so much for checking us out for your medication needs today, and we would love for you to be a part of our community here at Demi RX Care. In order to do that, make sure you hit that like and subscribe button down below, and also you can check out our free recipe to one of our diet plans here at Demi RX Care by clicking on the link below, and it will direct you to how you can download that recipe for that diet plan that we do have on our website. Thank you so much for checking us out again, and please stay tuned. Hi there. So we're going to go ahead and talk about our medication today. So our medication today is known as Sudafedrine. So Sudafedrine is also known as Sudafed, and this is mostly sold behind the counter in the pharmacy due to the potential abuse of this medication. So let's talk about Sudafed. So this medication is used in patients who have a condition called allergic rhinitis. So patients who have like a stuffy nose or stuffy sinus, this medication will be used in those patients, or in patients who have a nasal congestion and more of like a sinus congestion, of like patients who are feeling congested in their forehead, around their sinuses. This medication usually help in those patients. So how is this medication used? So this medication is normally used as a 60 milligram tablet that is taken every 4 to 6 hours, and usually the maximum is 240 milligrams. So we don't want the patient to take more than 240 milligram a day while they're on this medication. The medication usually comes in a 4 to 6 hour tablet. Sometimes it comes in a 12-hour tablet, and sometimes it comes in the 24-hour tablet. So the 24-hour tablet already contains the maximum dose the patient should already be on. So you just take that once a day, and it kind of helps you all throughout the day in terms of your sinus congestion or your nasal drainage that the patient is feeling at that point in time. So what are some side effects to look out for while you're on Sudafed? So some side effects of Sudafed include insomnia. So it's usually recommended not to take this medication closer to bedtime. That way you're able to sleep better, because like I said, this medication is for congestion, and it kind of acts as a stimulant as well. So patients usually don't want to take that closer to bedtime. So this medication can also cause some nervousness. It can cause anxiety or high blood pressure in some patients. So in this patient population that have hypertension, this medication is not recommended. Rather than taking the Sudafed, they will recommend you taking a quercetin HBP medication, which is actually more favorable and doesn't contain pseudoephedrine in it. Also, this medication can cause a side effect of restlessness in patients. Those are the common side effects to look out for while you're on this medication. All right, so let's talk about the serious side effect that you definitely want to be reaching out to your doctor for immediately when you start noticing those side effects. So this side effect or serious side effect include any abnormal chest pain. If you start noticing a pounding or a very fast heartbeat, you want to make sure that you're reaching out to your doctor, or any irregular heartbeat. Also, if you start noticing any wheezing or consistent shortness of breath while you're on this medication, make sure you're reaching out to your physician as well. Also, in patients while taking this medication, if you notice any form of seizures or convulsions or severe restlessness or any form of hallucination while you're on this medication, make sure that you are reaching out to your doctor as well. So as I always say, side effect is a two-way street. Is either you don't have it or you do have it, but these are just something to look out for while you're on the medication. And if you start feeling it, make sure you reach out to your doctor as soon as possible. That way they can rule out if this is as a result of that medication or not. All right, so what are other things to look out for while you're taking this medication? So usually we don't recommend this patient for our older patients. Because of the side effect of the medication, this older patients are more prone to have more increased side effect when it comes to their mental function when they take this medication. So it is not recommended in this patient population. Also, you want to, like I said earlier, avoid taking it closer to bedtime. That way you're already sick, you don't feel too good. You want to be able to sleep well at nighttime. So you don't want to take this medication closer to bedtime. That's why usually I would recommend maybe taking the 4 to 6 hour tablet. That way it kind of wears out before your bedtime and you kind of know how to space yourself out. And usually with the 24-hour one, it kind of slows, the effect kind of slows down all throughout the day. So if you do end up taking the 24-hour tablet, it might not affect your sleep as much. All right, so like I said, this medication does act as a stimulant as well. So you want to make sure that you're avoiding any other over-the-counter stimulant like the regular Sudafed or any other stimulant over the counter that can affect how this medication works mentally for you. Also, you want to make sure that you're reporting any signs and symptoms of any irregular heartbeat, heart rate, heart function that you may notice after taking this medication. Also, there's a group of medication called the monoamine oxidase inhibitors. These are medications that should not be taken at the same time as the pseudoephedrine, and they include phenelzine, selegiline, isocarboxacid, as well as tranylcypromine. So you don't want to take this medication around the same time as the pseudoephedrine in order to avoid any increased side effect with that medication. Also, in our patients who are less than 4 years old, this medication is not recommended for those patient populations. So usually in our patient population that are less than 4 years old, you want to be cautious about what you're getting over the counter for this younger patients because of those side effects and how their body might tolerate those medication. Also with the Sudafed, most especially if you are taking the 24-hour or the 12-hour long hour medication, you don't want to chew, crush, or break those tablets. You want to make sure that you're swallowing it as a whole. Except if the medication is a chewable tablet, then you want to make sure that you chew the chewable tablet completely before swallowing it. All right. Also, you don't want to make use of this medication for more than 7 days. Anything more than 7 days and you don't notice a improvement in your symptoms, you want to make sure that you're reaching out to your doctor and saying, hey, I've been battling this cold for the past 7 days. Do I need to come in? What test do I need to do? Make sure that you're letting your physician know. That way they can make sure it's not just like a viral illness that they need to give you another medication for. And also, depending on other symptoms that you may have, this medication might be something that you have to use in addition to another medication in order for it to help resolve those symptoms that you're feeling completely. And last but not least, make sure that if you do have a condition of hypertension, this is not, I repeat, this is not a medication for you. You want to make sure that you're trying the Coricidin HBP, which is used for patients who have a high blood pressure condition, for your cold or flu symptoms, if you are going to try a medication over the counter. Thank you for watching. I hope you were able to learn a thing or two regarding how to best take this medication. Make sure you give it a thumbs up as well as subscribe to our channel. And we look forward to seeing more of you here. Thank you for watching and stay tuned.